and then pain medication, right?
Yes. Hydration, then pain.
Yep. Hydration and then pain medication. That is correct. Okay. See how that breaks down, you know?
Yes.
Yep.
It makes so much sense
Makes
now.
sense.
Now I have an understanding of what this sickness and how it affects the body
Yep.
and how to begin to treat it.
Yep. And why you're doing what you're doing. Because the novice nurse will say, I'm going to treat my patient with pain medicine because pain is a priority and I want my patient to feel comfortable. But in actuality, if I have an occlusion, I can't effectively treat my patient because he doesn't have circulation. So let me establish circulation and then provide pain medication in that order. All right. Acute versus chronic. Okay, acute versus chronic. When we're talking about acute versus chronic, what will we use as far as pain medication is concerned? What will we use as far as that? Acute versus chronic. For pain management, I should say. If you
So
have, so for instance, so you have children, right? If your
yes,
children hit their head or something, what's the first thing you're gonna grab?
if they hit their head, I'm going to grab ice.
There you go. So we treat an acute situation with ice, cold therapy, right? So we use
Yes.
cold for acute pain, such as a sprained ankle, and we use heat for chronic pain, such as what? Rheumatoid
Heat,
arthritis,
heat bags.
heating pads, right?
Okay, that makes sense.
Hmm. What also is another non-pharmacological intervention we can use for chronic pain?
Is it homotherapy?
Hormone therapy. Hormones is medication.
No, not hormone. Is it homeotherapy? Like,
Homeopathic therapy.
yes,
Okay, let's be a little bit more specific for non-pharmacological interventions. What
like
about
massages.
what about guided imagery for chronic pain? Guided imagery will is caused what? A distraction, right? You ever heard people say, "Well, I don't even think about the pain anymore," because they've channeled their thought process to something else.
Okay,
Okay,
so that's image therapy.
guided imagery. It's called
Guided
guided
imagery.
imagery. Yep. Tell me the rule for nitroglycerin. What's the rule for that? For
That's a pain
nitroglycerin.
medication, right?
Nitroglycerin is for chest pain. Yes,
Chest pain. It's a patch, right?
it can be. But say if
Okay.
I'm a patient and I'm complaining, I'm coming to you, nurse. My chest hurts really bad. What are you gonna give me if I have an order for nitro? How is it given?
I thought it was a patch. It's not a patch.
That's one route we can give it. It can come in a patch form. It can come in a cream. It can also
Okay.
come sublingually, right? We can put it under our tongue.
Oh,
Mm-hmm.
under the tongue.
Yep.
Right.
Yep.
Oh, okay.
So we have nitro. We give it up to three
Okay.
times, right? Every 5 minutes. If the chest pain doesn't stop after the third time, what do we do?
Um, do we give them? Is that what we're going to?
You want to call the doctor.
Right, because there's nothing we can do after
Right.
that point.
We've given
Okay.
over a period of time, over 15 minutes, we've given them three pills, and they're still having chest pain. You call the doctor. Send them to
So
the
no
hospital.
positive, no positive results. Call a doctor. Okay.
Let's talk about some antidotes to medications. What is the antidote for heparin?
Is it heparin? It's some B12.
Nope. Starts with a P. That's okay.
Heparin. Antidote for heparin.
Protamine, protamine sulfate.
Protamine sulfate.
Yeah. What's your antidote for Coumadin?
Coumadin is like the same as heparin, right?
They have similarities. We're going to talk about that later too, about the differences between Coumadin and heparin.
Is that one potassium?
Vitamin K.
Potassium.
Nope. Potassium is K. I mean that's the symbol for potassium. But this is vitamin K. That's
Vitamin
different.
K. Okay.
Yeah. Vitamin K is the antidote for Coumadin. What's the antidote for Tylenol? People overdose on Tylenol all the time, right? Gotta know how to treat the overdose. It's called mucimist, but the word you want to learn is acetylcysteine, because NCLEX doesn't teach you. They don't test you on brand names. They only test you on.
Can you spell it for me, please?
Yes, acetylcysteine. ACETYLCYSTEINE. DKA. What is DKA? Diabetic ketoacidosis.
Diabetic.
Ketoacidosis. It's an acute complication of type 1 diabetes. That's what it is. It's an acute complication of type 1 diabetes.